edit this however we want. But all right, so what we're going to go over today is the remote patient monitoring portion of the RCP platform. And what that involves is the physical devices in a patient's home, and then the collection of the data from said devices, and on the provider side, how the staff and physicians are handle reviewing the data and also logging all activities that are considered remote clinical activities in order to be able to become billable for the healthcare organization to be able to be compensated for the actions taken of collecting the data, reviewing the data, and staying in touch with their patients. So what we're going to look at here is an example of a group. It's going to be an sample office. And what we're looking at is a list of the patients that are currently enrolled in the program. And one thing I want to make clear on in terms of the compensation side is that this entire program involves two billing codes. On the Medicare terms for them is CPT 99454, which is the actual collection of the raw medical data from the devices that are placed in the patient's home, and then 99457, which is the remote clinical time spent reviewing the data or speaking with patients or doing basically any actions that are considered remote clinical activities, which is any actions that are clinical activities that are involved with a patient when you're not physically seeing them. So this can include reviewing data, speaking with on the phone with the patient, doing a telehealth visit with the patient, calling the pharmacy to refill a prescription on behalf of the patient. Things along those lines are considered remote clinical activities. And you see here, you have the patient name, which programs they're enrolled with, their demographics, and then it shows a quick set of the devices they have enrolled. And then also here on the time, this is where we keep track of that remote clinical time that I referenced. So when we come in here to the patient info, you'll be able to see their assigned devices. Now, every patient involved has a hub in their home, and that's the choke point of where we collect all of the data from the devices via low power Bluetooth. And then the hub collects that information and sends it over a cellular wireless network to this portal here for the provider to be able to look at the actual raw data coming from those devices.
Who's
Here you
hosting
see
the data?
the data is hosted on RCP servers. We utilize Amazon Web Services, and that is the provider of the servers. So everything is encrypted from end to end, and there's also fail safes on the Amazon Web Services side as well to
Thank you.
protect that information. And as you see here on the assigned devices, on the patient, you'll see the devices that are given to them. Now, this is not a one size fits all. Each patient can have a different set of devices dependent on their condition, and the person who decides which devices they get is either is their provider. So, if they are a hypertensive patient, they'll most likely receive a scale and a blood pressure cuff to keep track of their blood pressure and their weight. If they're a diabetic, they'll get a blood glucometer and maybe a pulse oximeter to track the blood glucose levels in their system and how well their pulse and their oxygenation is with their blood. It's all dependent on the type of condition the patient has. And RCP offers about 6 devices currently. It's in our arsenal. And like I mentioned, we have the blood glucose monitor, we have our pulse oximeter, a regular contactless thermometer, a blood pressure monitor, a scale, and a spirometer, which measures breathing, and that's more for the chronic asthma patients in COPD. So when you're looking at the devices, again, like I mentioned before, there's the billing code 99454 is the actual, you get compensated by Medicare each month for the collection of data from the physical devices in the patient's homes. Now, when you're here looking at that, you can see that these are the readings that you receive, and they're all timestamped, so you know when a patient exactly when a patient took a reading. The way it operates on the patient experience is that they simply just turn their device on, and our hub activates, tells them that we recognize that whichever device that they've clicked is activated. And then, depending on the device, it's either stay still for 20 seconds, or for the thermometer, it'll tell them to pull and release the trigger for a reading. Each device will give them a little, tidbit on how to utilize it, just to make sure that they get accurate readings and things like that. So what I'm going to do here real quick is an example. I'm going to turn on the pulse oximeter, and you'll hear the hub activate and tell me to be quiet and still for 20 seconds.
Hi, your pulse oximeter has been detected and your readings are now being gathered. Please remain quiet and still for approximately 20 seconds.
So as I'm taking my reading, again, the hub is listening to the device over these 20 seconds, and what it'll do is, once the reading is completed, it's going to take it again, send it over a cellular wireless network. So this hub's not connected via Wi-Fi. This hub is not, it's not contacting it through an app on the patient's phone. This is literally just plugged into the wall.
You can now turn off your device. Thank you.
It is plugged into a wall, and it is connecting to the strongest cellular network that it can to send the data. And we are also network agnostic, so it's attaching onto the AT&Ts, the Verizons, T-Mobiles, whichever networks are the strongest around it, we're able to utilize and send the data. And when you come here, we look at the device logs, you'll be able to see this is the recent reading I just took. Now you'll see that the heart rate didn't capture my heart rate correctly there, so it's showing that there's a low heart rate. Every single device that you have, it has a range set, and this is specific to each patient. So for this particular test patient, which is myself, this is my typical range. Now, if it was a different patient, they would have a pulse oximeter, they would probably have a different pulse threshold that you'd be notified. So when you see here, if you can get a notification that a particular reading is low. We do this for every device. So for the scale, if their weight fluctuates drastically, there's an issue. There could be, if a patient, say they gain 7 pounds in a day, there's a possibility they could be retaining fluid. With a blood pressure cuff, you can monitor if their blood pressure spikes. Glucometer, it's the same concept, where you're able to see if their blood glucose level dropped, and same thing with the temperature. You'll be notified if a patient is running a fever. And again, this is all specific to each patient, simply because every patient kind of has a different set that is considered normal for them. And doctors don't, you want to only be you want to kind of pinpoint the patients that are having abnormal events, which is what is picking up when things are outside of the readings. Now, obviously, sometimes you'll have misreads on some of the devices. So with this particular heart rate, I can just clear that off. There's the blood oxygen level was good, and so I obviously know that maybe they moved their finger around while they were on the device, so it didn't get an accurate reading on the heart rate. So I can just clear that off, knowing that there's no issue here. And again, you'll see an entire list of all the notifications that you can see from all of the patients, and it'll give you an example of which device, which reading is the reason for those, for that alert showing there.
Even if you cleared them, they would still be retained in the system, correct?
Correct. So when you look at, you can see here on the old device logs, as long as they are still outside of the current set ranges, it's going to show up here like this on the patient in the history of the device reading. So you'll still be pinpointing all of those. You'll know that when you have cleared it, that someone has actually seen it and cleared it. Now, if you remember, I mentioned the remote clinical time spent looking at device readings. Now, what we've done with our system is we automatically track the time that is spent looking at the patient's readings on the system. So when you come here to the work log, you'll be able to see, one, that this is the provider that is looking at the patient. So this is myself as a doctor looking at myself as a patient. So that's why the names match. But typically, if you had a different, any staff member that would come in and look at it, they're being time stamped on how long they, reviewed the readings. And so that's all automated through the system. So you see here, everything is time stamped, showing that, these are the readings that I had. And the entire time I'm looking at those device logs, it's counting that time that I'm spending looking at the devices. And in the eyes of Medicare, there's a threshold when you look at each device, it's considered a minute. So if I spend, every new device that I click on, that's a new minute that I'm earning in time in terms of remote clinical time. And so we always suggest that doctors assign a patient, more than one device, typically 2 to 3. Because you're going to be getting more information and better overview of the patient's health, and B, it also makes it easier to get to that requirement of the initial 20 minutes. Now, when you combine the collection of the data, that billing code 99454, and then the 20 minutes of remote clinical time 99457, typically in a month, that is worth around $115 to $120 a month per patient to a practice. Now that varies from state to state by a few. That's why we give the range of 115 to 120. But typically is worth to the organization about $54 a month to collect the information from the patient. And then for a patient to be compliant, they need to have 2 readings out of the month. So that means they have to have 2 days worth of readings. So if they took 10 pulse oximeter readings in the same day, that would still, in the eyes of Medicare, that would still only be considered a single day's worth of readings. So they need at least 2 days worth of readings in a month. And then again, like we mentioned, the practice needs to accumulate at least 20 minutes of remote clinical time with the patient. Now, again, like I've touched on, there's multiple ways to achieve that 20 minutes. One I showed you is by looking at the device logs, which is that action of reviewed readings. Another is communication with the patient. Now, if you want to place a phone, say you come in, you see a reading that's a little out of abnormal for that patient, and you want to place a phone call to the patient to see if there's any issues going on, our portal allows you to contact a patient. And so what this does is this allows the provider or staff member to, wherever they are, we will place a call to them. So be it their office phone, their home phone, or most likely their cell phone. That's the number you plug in here. We place a call to their cell phone, and then what we do at that point is forward the call to the patient. And the caller ID that the patient sees is going to be the practice's caller ID. There's going to be no personal information that's shown to the patient on their end, and they also know that it is their doctor that is calling them, or that their doctor's office is the one calling them. In the entirety of that phone call, the time will be automatically tracked and plugged into the work log here. So that's another way you can accumulate remote clinical time. And then we also have the ability to manually add time to their work log. So if a patient places, or if you want to place a prescription for a patient, the time you spend with the pharmacy can be considered remote clinical time. So you're able to come in here, so you can type in this task description that I refilled meds, and you can type in the notes of which medication you were filling out for the patient, and then the amount of time spent on that. And then you add that time to the work log, it'll automatically be attached here. There's 2 reasons for why we wanted to automatically capture everything that's done on the portal in the work log. One being the ease of use for the users. The staff doesn't need to sit there and kind of count out the minutes of how long they were looking at devices and how long they spoke with patients on the phone. It just makes it easier for them not having to relay the amount of time and take the time logging what they actually did. And secondary is that we wanted to be as granular as possible on every action that you have, simply because for the purposes of Medicare. In the case of an audit or anything like that, you want to have as much detail as you can on what you have done actively as an organization with your patients, because this is a Medicare program. there is quite a bit of scrutiny that can be involved with it because of the amount of Medicare fraud that's occurred in the past. This is something that helps protect you because it'll show, which staff member had their action, and everything is time stamped and logged. So they're able to come in, look at those logs, and see that everything is copacetic, everything has been done properly, that they're not fudging numbers when it comes to amount of time logged with patients and things like that. So it's a twofold reasoning for being that granular. And also, again, on the prior point of collecting all of the actions taken, that also helps maximize the compensation that the organization can receive in terms of those billing codes, because we want to make sure that you are being compensated for the time that you spend monitoring, and we want to make sure that we make it as easy as possible to reach that 20 minutes of remote clinical time for your patients. And when you come here and looking at the device logs, the individuals that have access to that information would be part of their care team. So you see here, this is the doctor looking at the patient here. You'd be able to list out, the physician, the nurse practitioner, the medical assistant, the PA, anybody who would need access to this patient's information, because all of the time that is spent looking at the device logs, it counts the same, whether it's the doctor looking at it, the nurse, the medical assistant, or the PA, anybody who's involved on that patient's care team. The time spent, it all counts the same for that particular patient. So it's not like the doctor spending 20 minutes looking at the patient information is compensated more than the MA. It's anybody who's on that particular care team. Their time, their remote clinical time counts the exact same across the board. And so what that allows organizations to do is they can allow multiple members of their staff to take part, and also not only just to accumulate the time, but the whole point of the program is to catch any issues that a patient might be having prior to a hospital visit. You want to have as many eyeballs as you can on the patient readings, so that way if there's any abnormalities, you're able to capture that and then make any type of clinical decisions that are necessary, or even escalate to a different specialty if needed, things like that. That's the crux of the program. That's the reasoning for the Medicare billing codes existing, is to prevent the hospitalization of patients by this preventative medicine route, by being vigilant on collecting the information from patients, collecting more information from patients, and actually utilizing that information to make care decisions. One side effect, that's a positive side effect of this program, is that what we've seen with patients that have been enrolled is that there is a significant behavioral change in the patients with chronic conditions. And what we mean by that is that when they're taking their readings, they become a little bit more diligent about utilizing their devices when they know their doctor is going to be monitoring their readings, as well as depending on their condition, their care outcomes tend to improve, because they know if their doctor is going to be looking at their blood glucose, their glucose levels, they might not have that extra donut in the morning, or they might not, they might eat a bit healthier, knowing that they're going to be taking their reading in an hour or so. It's similar to the same thing with hypertensive patients. They might eat a little bit less salt when they know their doctor is monitoring their blood pressure on a regular basis. And it's things like that have we were surprised on the response of the patients on how effective that has been, and that really has led to some very positive care outcomes with patients that are actively on the program. And so for now, that concludes the demo of the actual remote patient monitoring portion with the devices on the patients. So I'll open it up to questions if you have any.
One of the things that came up during the patient point call was that they described, an average Medicare patient might have 10, 12, 16 different medications that they're on. Mm-hmm. And I'm assuming our portal is allowing us to see what medications the patient is on?
Yeah. So what you'll see here too is that once we get to that point, you'll be able to on the patient data, it'll be included here in the health data and ranges. So you'll
But
be
there,
able to see not only what their primary conditions are, what their what their secondary conditions are, but we're going to be adding in the medication types and
the thing
what
that
times
came
a
up that
day.
was the thing that came up during the call that was interesting was a request to be able to monitor whether when the patient is supposed to be taking the medication and notifying them or alerting them that, hey, it's time to take your medication, and track whether people are compliant with taking their medication. Because
Uh-huh.
one of the things that can throw somebody's outcome off dramatically is if they're not taking their medications on time.
Correct.
The other thing that came to mind was you've heard of PillPack,
Hmm.
where it's free service. I think Amazon owns it. They pack if you're on more than one